Hello, everyone. This is Dr. Mike Chua again, physical therapist. And yes, we are here at Lifestyle Vision. We're going to be talking about what is the difference between the cataract and glaucoma with Dr. Trent Martin here. We'll be back in a few seconds, okay? All right, we are back. We are here at Lifestyle Vision. Shout out to Lifestyle Vision. We are here with Dr. Trent Martin. Again, if you're watching live, comment live. Watching on the replay, comment replay. But tonight or today, we're going to be talking about what is the difference between a cataract and a glaucoma. And we have Dr. Trent Martin here. Dr. Trent, could you please tell us who you are again? What do you do here at Lifestyle Vision?
Hey, thanks, Dr. Mike. Yeah, Trent Martin here at Lifestyle Vision. We are a new practice here in Thompson Farms. So we do cater to primary care, eye care, try to cover all our bases. We try to do our glasses, our contacts, disease, you name it. We can probably take care of it here.
There you go.
That's the goal,
eyes, right?
We want to be the eye care.
There you go. Primary eye care through Lifestyle Vision. Well, anyway, so our topic for today, for those people who are watching live, please comment live. Watching on the replay, comment replay. And if you can hear us, type in you can hear us. So what is really the difference between the cataract and glaucoma, and what is cataract and what is glaucoma, Dr. Trent?
Yeah, so they're both things everybody knows. They affect our eyes, but they're very different. Even though they get confused a lot, they are very different in their process. So one of them being cataracts, we'll start there. That cataracts is actually, it's inside our eye as well. Both are processed inside our eye. They're things we can't see without looking into our eyes, but cataracts themselves are the clouding of the lens inside of our eye. So that sounds terrible, and yeah, it is. But the good thing with cataracts is they are reversible, or we can remove those cataracts and pretty well instantly have clear vision again.
So what are the possible interventions for cataracts? And then, of course, another question is the cloudiness. Is it on the middle or on the side, or is it on the front? How does that work?
There are different types of cataracts, but the lens itself, it's in the middle. Now the layers of the lens can be affected. You could have cataracts that affect the middle, the outside. Either way, visual outcome is blurry vision, right? So but as far as prevent them, that sort of thing, age is a risk factor, of course. I think we know that. Systemic health, making sure have our diabetes, our high blood pressure, cholesterol, all those sort of things under check, that slows them. And number one probably is UV exposure. So wearing our sunglasses, that sort of thing can prevent that damage that happens to the lens that causes it to cloud up. So
So you heard that, ladies and gentlemen. There are both, internal and external factors. Internal, basically your diet, your blood pressure, your heart rate, your oxygen, your diabetes, like what Dr. Trent said, and also the external factors, which is, the sunlight, too much sun that goes to your eyes, the UV factors and everything. So that's cataract.
Cataracts, yeah. Okay. And like I said, another one that we get confused a lot when we talk with patients is glaucoma. It seems like everybody knows someone that has glaucoma, right? But the difference being glaucoma is actually affecting our nervous system. So it's affecting the nerve that's sending the picture from our eye to our brain.
Which nerve is this, Doc?
Yeah, our cranial
nerve is
cranial nerve. It's our optic nerve. Right, there we go. Yeah, I'll get it right there too. So our optic nerve, it is being damaged in glaucoma. And primarily there are several risk factors as we learn more and more about it. But the most common is high pressure inside your eye.
High pressure.
This is not something like blood pressure where you have too much sodium or something like that, and you can fluctuate it. There are a lot of factors that unfortunately are outside of our control, and the biggest being genetics that cause high pressure in our eye. So Again, one of the differences though is unlike cataracts where we can operate, we can have instant success and see clearly again. Um, the damage once it's happened is irreversible with glaucoma. So the key to both, particularly glaucoma, is early intervention. And I mean, finding it before, our goal is to find it before you see it affecting your life. So
that's true.
That's what we're doing.
Again, if you're watching live, comment live. Watching in a replay, comment replay. If you have any questions, type in on the chat box. Right now, there's nobody typing there, but thank you very much for those people who are watching. Appreciate you. So you mentioned about optic nerve.
Right.
Those different cranial nerves that we have, the olfactory, the optic, the auditory. So what is it with that nerve that it is? Is it what is it that it's what does it? Why the optic nerve? Is it from the back, or is it just from that nerve distribution towards the eye? I mean, how does that affect? How does it become like a glaucoma?
Yeah. I use the example a lot of a balloon. If you've ever blown up a balloon too much, how where you tie it off, it stretches and cones out. All right, it's kind of that same process. If the pressure inside our eye is too high, the weakest spot for that pressure to push against is our nerve itself. So that pressure is weakening that tissue there, kind of like stretching out that balloon.
So it's really not the nerve itself. It's actually the high pressure of the whatever you call that, the orbital pressure there, and pushing against the optical nerve. Okay.
Like I said, there's a lot of factors that can contribute otherwise that are a little more complex, but in most cases, yes, that's the process of how we're in glaucoma.
See, I'm learning, ladies and gentlemen. I'm just a physical therapist. All I know is muscles and joints and cartilage and exercising, and now I'm learning, right? So again, you're the average of the 5 people you hang out with. So who are you hang out with today? I'm hanging out with an awesome eye doctor here. So I'm learning about vision. I'm learning about lifestyle, right? Lifestyle vision. So Doc, now that we've talked about the pathophysiology, the causes, right?
Right.
What are the treatments that we can do?
The majority of times, like I said, I'll go back to this pressure. The majority of times, bringing your pressure down is enough to prevent progression. Now, like I said, there's a lot of factors in that, but our goal is always to bring that pressure down to the point where we're no longer damaging our nerve. And a lot of times that can be accomplished with eye drops alone.
Eye drops, okay.
And the most common is 1 drop at bedtime. So it sounds like, got to take this medicine, on a rigorous schedule, but it's really 1 time a day before you go to bed. And that the wide majority of people, it controls their pressure. So
it's like a vasodilator or a vasoconstrictor eye drop?
They all have a little different mechanism of how they work, but in general, it's either to increase the outflow of fluid or decrease the production of fluid to reduce the pressure inside of our eye. So we still need those nutrients coming in and fluid, keeping everything healthy, but we can regulate that pressure by either decreasing its production or increasing its outflow. So,
let me ask, I'm just learning here, ladies and gentlemen. So the pressure, how does one increase their pressure in their eyes? I mean, I know blood pressure, central nervous system increases your sympathetic nervous system, high blood pressure, eating salt, but how does one increase their pressure in their eyes? Is maybe I'm looking at a beautiful girl or a good-looking guy, or does that increase my pressure?
I wish there was something that easy to spot. It is, like I said, majority genetics. There's nothing you did. There's nothing you could do to prevent it, to be honest. But for some, it could be something like trauma, and we damage that drainage system that fluid's going out. So now we've got to back up and we're increasing pressure. So trauma could be one factor for
concussion. Is that a factor too? Playing football or something like that, increasing intracranial pressure, could that be a factor too?
Particularly, it would need to damage the eye itself in most cases.
Okay, all right.
And in most cases, it would need to. But you could, as far as not veering off a little bit from the pressure, things that damage blood flow to your nerve. So maybe we don't have the high pressure pushing on it, but we have a weak nerve from cardiovascular event or something even. We could have poor perfusion to that nerve when we're laying down at night, and say we're just not getting a great blood flow to it. That weaken it enough could, even under normal pressure, let it stretch out and weaken a little bit. So it's a lot of factors to it.
You mentioned about positioning. So does that affect you? I mean, sleeping and everything.
Right.
Oh, thank you
There's a
very much.
reason.
Thank you very much, Tony, for watching live and the
Thank you.
great information he said. So thank you,
Thank
Tony.
you.
Mhm.
Yes, at nighttime, when we're laying down, is when our pressure in our eye is our highest. So
Oh.
that is why those drops are generally dosed at nighttime, is
Mm.
so we can reduce that pressure at its highest.
Mm.
And
Normally, my pressure is high when I'm sleeping beside my wife. It's like I'm so nervous, right? So, just kidding. So that's true. Different body, different move. Now, I normally do this with my patients too. I check their blood pressure laying down, check it sitting, and check it standing, and see if there's a difference of blood pressure in whatever their position is. And same thing when you're doing X-ray or MRI. The positioning is a big factor too, because when they're laying down, obviously there's no joint pressure. There's no pressure in their joints. And then you stand them up, obviously, boom, it will show bone and bone, right? And same thing with the pressure. What he's talking about right now, there is a difference in pressure. So if you have that, doc, do they need to go to to you, of course,
right,
but
right.
what's the intervention there? I mean, aside from the drops and everything, if they have increasing pressure laying down, do you recommend them sitting up or something like that?
No, most cases that's what we would do. And I mean, it does get worse typically peaks at nighttime. But um, as far as being elevated or things, I'd have to look into if there's any
Mm-hmm.
studies that show that actually reduced it overnight. I
Mm.
don't know of any, to be honest. But um, for most cases, that one drop will control it through the
Okay.
night,
Mm-hmm.
even in when they're laying, um, and make it through that next day. Until then, again, that pressure will be maintained. Now, there are some newer and like I said, it's still pretty new to us. We know a
Mm-hmm.
lot, but there's still a lot we don't know, and there's a lot of new technology coming out. One of them particular is trying to make, I don't know anybody that knows how to check their pressure at home, right? To
Yeah.
check their eye pressure. Well, they're coming out with new devices that are
Wow.
more patient friendly that they can take home and check and make sure, just like checking your blood sugar, just like checking your blood pressure. You can check the pressure in your eye and see, like, okay, are we getting too high and we need to do something a little bit
Wow.
more, and
Wow.
we can always compare those numbers instead of one spot check during the day
Wow.
seeing us. So
Amazing. The technology is just evolving,
uh,
right? So speaking
very
of
quickly.
technology, doc, I mean, what kind of equipments or interventions or procedures that you do here in the clinic, like test or whatever, aside from Snellen's chart?
Gotcha. Yeah. I mean, so of course we do the charts and we can check
Hmm.
acuities and all. We can do autorefractor, the curvature of our cornea. So
Mm,
checking that kind of thing for other diseases like keratoconus,
mm.
particular. Um, we can do. I know a lot of people are fans of the checking your pressure is actually here with no puff of air.
Hmm.
So
So do you
we
do that
don't
here
use the
too?
old puff of
Oh,
air,
you don't do
right?
that?
Right. No, we don't at all. So there's a
Oh.
newer device. It's actually what created the device I was talking
Mm.
about. Um,
Wow.
so in
It's
general,
good that you don't do that because I'm like always closing my eyes when
yeah,
they do that to me.
we've had a lot of compliments on that
Yeah,
lately
yeah.
again. So that's a new change. And um, in general, dry eye,
Hmm.
taking care of dry eye patients, there's been a lot of things come out there. So doing some testing for dry eye,
Hmm.
for our contacts, and that sort
Hmm.
of thing. So, and like I said, just eye health in general, being
Cool.
able to do uh, microscope exam and that sort of thing.
Wow, wow. So again, could you please tell us again where are you located, your
And
telephone number and everything? I think I put down his website and telephone number here too. So
yeah, so we're at 1296 Union University Drive, and that's here in Thompson Farms, Jackson, Tennessee. And our phone number is 731-513-5755. So yeah, if you have any questions or anything come up, y'all give us a call.
cool, cool,
We can
cool.
talk about it.
There you go. Well, again, thank you very much, Dr. Trent. Appreciate you. Again, before I let you go, always remember the word fast. FAST, letter F. Find friends, find people that will bring out the best in you. Find a doctor, an eye doctor, that will bring out the best in you because you want a thorough evaluation. That's what we do too in our therapy clinic. Jerhab, we do a thorough evaluation on you. That way we can find the root cause of what's causing your pain, causing your weakness, causing your loss of balance. And, half of the time it's the eyes because they're losing balance because their eyes are weak. So that's the reason why we have lifestyle vision here too. So find people that will bring out the best in you. Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do Dr. Trent good if you don't take action. Take
Right.
action by going here, getting your eye exam, take action just one day at a time, one step at a time. It doesn't have to be perfect. Just do one day at a time, okay? One step. Next is letter S, share and subscribe. Share Lifestyle Vision. You got Facebook page,
Yeah,
sir?
thank you. Yeah,
Share,
absolutely.
share and subscribe on Lifestyle Vision, because the more shares, the better. It may not be applicable to you, but it could be applicable to somebody else, right? Somebody who needs some eye checkup or someone else, right? And last but not least is letter T, is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, that's like what Dr. Trent is doing. The more you understand it, so share. Teach other people what you've been learning in our Facebook Live. Again, thank you very much, Dr. T. Anything any last parting wisdom for our guest or for our group?
Nothing. I appreciate it though. Thank
All
you for
right.
stopping by.
Well, thank you again. Appreciate you. Be awesome. Be great. Be excellent. And we'll see you on our next Jerry Hab show. Thank you.